I am going to demonstrate scanning for an appointment. Scanning locates openings matching selected user criteria. It also ensures that scheduling conforms to the rules defined for your practice. This results in optimizing office productivity while giving your patients various times to choose from. Note: the patient's name, along with other helpful information, is displayed on the title bar of the scheduler. Select Scan from the command bar. I confirm that this is the correct patient by clicking OK, or optionally use Find to locate a different patient. Next, the reason for the appointment is determined. This is typically done by selecting one of the user-defined quick procedure buttons or using the treatment plan lookup to appoint a planned treatment phase. Essential appointment information is defaulted but may be changed here. Click OK. Select a provider or a group of providers from all hygienists, doctors, or doctor books. This is typically defaulted based upon the patient's preferred providers and/or the nature of the procedure selected. Click OK. The next dialog allows the user to select specific times of the day or days of the week. If a hygiene appointment is being scheduled, the start day will default to the patient's recall due date. Click OK. Available appointment start times are displayed in gray. Choose a time to place the appointment. Double-click on the time slot to display the detailed view for the selected time. Place the appointment by double-clicking in the desired time slot. For tracking purposes, my system has been optionally set to require user identification. The appointment is saved.